All right, let's talk about heart medication. You know, you look at this tiny little pill and you have to wonder, how on earth can this thing protect the hardest working muscle in your entire body? Well, today we're going to demystify all of it. We're skipping the super dense medical jargon and getting right to the good stuff. What these drugs do, how they actually work, and most importantly, why it matters to you.
It's a pretty incredible thought, right? That little pill in your medicine cabinet is a key player in a massive strategy to keep your heart ticking along day in and day out. But to really get a handle on how these medicines work their magic, we first have to understand the challenges they're built to solve.
So what are these common foes that our hearts are constantly up against? Because once you get the problem, trust me, the solution makes so much more sense.
When you boil it all down, it really comes down to three big things. First, you've got high blood pressure, or hypertension. Think of it like running your home's plumbing with the pressure cranked way too high. Something's bound to give. Second, you've got clogged pipes. This is all that nasty buildup from cholesterol or the risk of a dangerous blood clot forming. And third, you have an overworked heart. This is when the pump itself just gets tired or weak or totally out of sync.
Okay, first up, let's tackle that high-pressure problem. How in the world do these medications convince your body to just ease off the throttle a bit? Well, the first tool in the toolbox are diuretics, which you might know as water pills. The best way to think of them is like a pressure release valve. Drugs like hydrochlorothiazide or the more powerful one, furosemide, they basically give your kidneys a nudge to flush out extra salt and water. This reduces the total amount of fluid in your blood vessels, and voila, the pressure comes down. Simple as that.
But you know, it's a really delicate balance, because by flushing out all that fluid, these meds can sometimes lead to dehydration, or they can throw your electrolytes, especially potassium, out of whack. You know that feeling when you stand up too fast and get super dizzy? That can be a key sign, and it's definitely something to watch for and chat with your doctor about.
So besides just getting rid of extra fluid, another major strategy to lower blood pressure is to get the blood vessels themselves to just relax and widen up a bit. And two of the biggest players in this game are ACE inhibitors and ARBs. Now, both of these guys have the exact same goal. They block a natural system in your body that likes to tighten up blood vessels. But here's the really interesting part, the side effects. ACE inhibitors, like lisinopril, are kind of infamous for causing this nagging, dry cough. So science came up with ARBs, like losartan, which found a different back door to do the same job, but without that annoying cough. It's a perfect example of how medicine gets better and more refined over time.
Next up, we have the beta blockers. And here's a little cheat code for you. You can almost always spot these because their names end in LOL, like metoprolol. These drugs are basically whispering to your heart, hey, just take it easy, chill out. They work by blocking the effects of adrenaline, which means your heart beats slower and with less force, which, in turn, lowers your blood pressure.
But telling the heart to chill out comes with some really important rules. Since they slow the heart down, a dose is often held if your heart rate drops below 60 beats per minute. For folks with diabetes, this is huge. They can actually hide the warning signs of low blood sugar. And stopping them suddenly, that is a big no-no. Your body can have this rebound effect, causing a really sharp, dangerous spike in your blood pressure and heart rate.
Okay, so we've eased the pressure. Now let's talk about our second major foe, blockages. We're talking about the gunk that can clog your arteries and create these awful traffic jams inside your circulatory system. When it comes to managing cholesterol, the absolute superstars are the statins, like atorvastatin. The easiest way to think about them is like this. They're a new manager for your body's internal cholesterol factory, which is mostly located in your liver. Statins work by blocking a key enzyme that the liver needs, essentially telling it, hey, let's scale back production on that bad LDL cholesterol, okay? And this isn't some rare niche issue. This is incredibly common. We're talking over 90 million adults in the US alone who have cholesterol levels high enough that they could benefit from a medication like this. That makes statins a real cornerstone of modern heart disease prevention.
Now, beyond just cholesterol plaque, there's the immediate danger of a blood clot. And to fight that, we've got a great 1-2 punch. First up are antiplatelets, like clopidogrel. They make your platelets, the tiny little cells that kick off a clot, less sticky. Then you've got anticoagulants, the famous blood thinners like warfarin or rivaroxaban, which slow down the whole complex chemical reaction that actually forms the clot.
So here's the unavoidable flip side, right? If you're making your blood less likely to clot, the number one risk is, of course, bleeding. And that's why doctors are so serious about simple but vital precautions. Things like using a soft toothbrush, using an electric razor, and staying away from other drugs like NSAIDs, think ibuprofen, that can also thin your blood.
All right, last but certainly not least, let's talk about the heart muscle itself. What happens when the pump gets tired or weak or starts beating to its own chaotic drum? Yep, you guessed it, there are medications for that too.
Two classic drugs here are nitroglycerin and digoxin, and they help in totally different ways. Nitroglycerin is for that sudden chest pain, angina, because it works super fast to widen blood vessels, which immediately eases the heart's workload. Digoxin, on the other hand, is more for long-term heart failure. It actually makes the heart muscle contract more forcefully, but a little slower, making it a much more efficient pump.
Now, digoxin is an incredibly powerful drug, but it comes with a massive warning sign. It has what's called a narrow therapeutic range. That's just a fancy way of saying the line between a helpful dose and a toxic, dangerous dose is razor thin. It's like walking a tightrope. This is why it is absolutely essential for anyone taking it to be monitored for early signs of toxicity, like nausea or weird vision changes.
Finally, what if the problem isn't the muscle or the pressure, but the heart's rhythm? What if the electrical system is on the fritz? That's where anti-arrhythmics, like amiodarone, come in. The best way to think of these is as electricians for your heart. They work directly on the heart's electrical pathways to fix faulty rhythms, like atrial fibrillation, and get everything beating back in sync.
Okay, wow, that was a ton of information, I know. But what if I told you there's a simple cheat code, a secret decoder ring to help you remember the big categories of these drugs?
Check this out. This is your personal decoder ring for hard meds. Just look for the patterns in the names. If a drug ends in pril, you can bet it's an ACE inhibitor that relaxes blood vessels. If it ends in sartan, it's an ARB doing that same job. See that lull ending? Bam, that's a beta blocker that slows the heart. And statin tells you it's a drug for lowering cholesterol. Just knowing these few endings gives you such a powerful clue about what a medication is designed to do.
So look, the goal here isn't to turn you into a pharmacist overnight. It's to empower you. Understanding the why behind your medication, why you're taking it, what it's supposed to be doing, and what you should watch for, it completely changes the game. It allows you to have smarter, more informed conversations with your doctor. It turns you from just a passive patient into an active partner in your own health. And that's what this is all about.